Did you come up with a cause, and why did you choose that specific cause?
After seeing the poor suffer due to lack of access to the basic health care and health education during our multiple medical mission trips to Vietnam, we wanted to establish a foundation for good medical care to improve the conditions. Primary health care is the answer. The concept of primary health care is very important because it encompasses both preventive and curative approaches, making care more comprehensive and cost-effective. Implementing the concept of primary care requires a clinic not only equipped with necessary medical supplies, but also with the knowledge to operate this new system. Our approach involves making small changes and identifying unforeseen challenges. Dun Tan Clinic were very receptive to our proposal, and that is why we choose to partner with them. In short, that is how the Prim Care project was formed. We're a student-based nonprofit organization that aims to support our student members as well as the community. Through our collaborative efforts, we are able to develop educational programs that benefit the Vietnamese community. Our mission instills within our members a sense of passion to cultivate the healthcare system. VNMAP's Prim Care project holds the same philosophy. This is the pilot project that promises long-term benefits directly to the target serving population in Vietnam. Potentially, we can multiply its results to many other communities. Part of the VNMAP mission is to develop young leaders who have the desire and passion to improve their community. The Prim Care project is no exception. Many of the Prim Care project volunteers are undergraduates and graduate students. We continuously encourage more volunteers to be involved. Part of this project is also focused on training students to become a catalyst for health programs through the Interprofessional Knowledge Exchange Program, also known as ICAP. VNMAP is looking forward to partner with UNASA members to implement the Prim Care project and mentor UNASA as a participant in the ICAP program.
How does your organization plan on measuring the success of your project?
The ultimate goal of our project is to improve the health of the poor. In order to achieve that goal, we will implement different stages of the project. During the implementation phase, we will utilize different methodologies to measure our accomplishment on different stages. The first is the health outcome measurement. Before the implementation phase, we have researched and identified the dengue fever and high blood pressure to be the major diseases in Dun Tan commune. By establishing a successful primary care community clinic, the clinic providers will be more effective in diagnosing and treating the disease as well as educating the community on how to prevent the diseases. The VNMAP team will work with the clinic to monitor the diseases and to compare the prevalence and incidences of the diseases before and after intervention. The second is of objective measurements. During the implementation phase, we will carry out different programs such as the ICAP and patient education. These programs will be evaluated based on participant satisfaction. We will use the survey questionnaire for this purpose.
What would you do if and when you reach your goal?
Our job is not done once we have reached our goal. We have to work with the local people to sustain our efforts. From the beginning of the planning process, we have realized that having this project continue once we leave is key. For that reason, we involved the community in the project from the start. We helped them to see that this project as their own and empowered them to work together to take care of not only themselves, but also their community. Once our project is met, we will continue to work with the local people to provide technical assistance and to support them in the transition to become self-efficient. In addition, once we have successfully established an effective and efficient primary care health center, we want to share the process of planning and implementation to other communities in Vietnam. We want Dun Tan Clinic not only be a place of care, but also a place of learning where other providers, public health workers, government officials can come and learn how we approach health problems. VNMAP members believe that knowledge is important and that we can help more people if we can share our success.
If you had to promote your cause in 30 seconds, what would you say?
A healthy community is a better, productive community. Primary care is the foundation of a healthy community and should be a priority to ensure effective, preventive, and curative care. Improving primary care is a collaborative effort among VNMAP, people in the community, local authority, and healthcare providers. Success of this program will save lives and keep thousands of people in the community healthy. We hope that